The whole way to deal with diabetes is the fact that you start with these are some of the common blood works that you can be doing for your kids, especially if you're starting to see symptoms of missing their period, weight gain, or hair fall, which is very uncontrolled.
32-year-old woman showed up to the clinic saying that she feels low energy levels. So we ran her blood test and everything seemed pretty normal. So we digged deep into and we found that the anti-TPO and anti-TG. I want you to throw some light on PCOS conditions because it's been faced by many women in recent times. Earlier, it used to be 20 to 30 years old. Usually,
now we're seeing as young as 15-year-old girls
absolutely,
as well
that's
having it.
right.
One of the prime reasons why PCOS is going undetected among younger girls these days is the fact that irregular periods has become very common. The third most common one is diabetes.
Yeah.
It's very common among Indian women and Indian men. Yeah.
They just want to be a perfectionist in everything, so
Absolutely.
they have stress all around. Their insulin being spiked up all the time, your carb cravings goes up, and then you indulge on a carbohydrate-rich diet, and that's when the diabetes.
Hi, this is Ritu.
Hi, this is Ritika.
Today we are going to be talking about some of the most important women health problems on the Women's Day occasion, and we'll be uncovering some of the most common medical conditions like
Autoimmune diseases, PCOS and diabetes, and also the role of diet in these diseases.
And also, we'll be discovering some of the top secret superfoods for all of these medical conditions. So, stay tuned and watch the video till the end. Hey Ritika, so how do you feel the Bangalore weather is? You've just come down from Chennai so far, and have you liked the place?
Yeah, it's really pleasant and cool when compared to Chennai.
That's
Yeah,
good,
it's amazing.
absolutely.
Yeah.
So today I think we're here to undiscover some of the pointers that about young women's health,
Yeah.
especially autoimmune conditions which are on the rise,
Right.
right? So autoimmune conditions especially affect younger women, and we've seen the stats grow over the years.
Right.
1 among 10 cases of younger women who come into the clinic are autoimmune condition based.
Right.
And today we don't really have science still backing up to uncover the truth behind this. So could you explain to us in your terms or in simpler terms why these autoimmune conditions happen in the first place to women?
Yeah, so to put into very simple term, imagine your body is an army and army's job is to defend from intruders like bacteria and viruses. So the problem comes up when the army attacks the own immune system, which give rise to chronic inflammation and diseases.
Well, I think that's very nicely put across to all our audiences watching this video. To be very honest, these days, the number of cases are on the rise, and especially among younger women, we are starting to see about different types of autoimmune conditions. And in some of the cases, we are also seeing mixed autoimmune conditions, which means the person goes beyond having one disease at a time. So these are being undiagnosed, and there are about 100 different types of autoimmune conditions that are affecting younger women, and this awareness at this point is very low, and we should be trying to see what could be one of the root causes of these autoimmune conditions that's happening so far. So Ritika, why do you think autoimmune conditions have gone so higher among younger women and the diagnosis is too late?
Yeah.
Can you throw some light on that? Do you have any case that you have earlier done?
Yeah, so it's mainly because of the hormonal imbalances, genetics, and the stress factors. So in fact, I had a classical case of Hashimoto thyroiditis. A young woman showed up to the clinic saying that she has low energy levels, fatigue, and sleep issues, and especially excessive weight gain. So we ran through the normal blood tests, and everything seemed to be normal. So
including her T3, T4,
yeah, everything was so normal, and we digged deep into the blood parameters, and we found that the anti-TPO and the anti-TG were deranged, and so we also checked for her other inflammatory markers like the CRP and ESR, which was parallelly inflamed. So we put her on an anti-inflammatory diet, and slowly her gut microbiome was restored, and also she was getting slowly better.
Okay, so what do you think about the HSCRP and the ESR parameter that you were just talking to us about? The autoimmune cases, how important it is to go back and check inflammation markers, and what does it generally signify about gut health?
Yeah, so there's a strong correlation between the inflammatory markers and the autoimmune parameters as well. For example, as I just mentioned about the anti-TPO and the CRP itself. So when we correlate each other, we try and reach to the main culprit of what's causing the problem.
So that is where the main root cause comes in from,
Absolutely,
because of
that's
the
right.
inflammation that is
Yes.
happening in the
Yes.
body. Okay.
Right.
So this inflammation marker
Yeah.
is the one that's actually attacking our cells in our body,
Yes.
and our immune system then gets triggered
That's right.
to then start attacking its own cells.
Absolutely
Yes.
right. Yes,
Okay.
that's right.
So what has been your success story today about this client that you just gave us a brief about? What is her progress so far, and how is she doing in terms of her overall health? How does her deranged parameters now look like?
Yeah, so when we started this anti-inflammatory diet, first all the symptoms like her low energy levels, sleep, and everything got better. The weight loss was happening gradually, but all the internal symptoms like the fatigue and sluggish all the time. So she was feeling much more better when she was with us. And I think strongly I believe that the diet that she was having
Has
like
a huge role.
huge role to
Yeah.
play about, like the inflammatory diet that she was having earlier.
Yeah.
And when we started on this clean diet, so she was just doing absolutely better.
Okay. So Ritika,
Yeah.
do you think these autoimmune conditions can be reversed, and can we give a ray of hope to our clients watching this? Or what do you think of it?
When we are on a clean diet over the years, these symptoms and condition can be managed, but since it got triggered at some point of life due to those factors that I mentioned earlier, this unfortunately can't be reversed. This
Okay,
can't be
got it.
reversed.
Yes.
Yeah.
Because I think a lot of people who watch this video
Yeah.
and are probably even having one or two symptoms like you just mentioned,
Right,
and they're
right.
not being diagnosed so far with the blood
Yeah.
work, would be thinking that these conditions could be reversed
Yeah.
by doing some dietary and lifestyle modifications. But unfortunately, we don't really have currently a situation where we can reverse an autoimmune condition, because
That's
this is
right.
an inflammatory condition as well.
Correct,
So
correct.
all through the time we can just keep managing it
Yeah.
with dietary and lifestyle modifications, and also help our clients get into a more healthier
Yeah.
routine.
And also early diagnosis is the key. So when something is diagnosed in an early stage, so we can better manage it with organic ways like having clean food and
Absolutely.
yeah, exercise.
Absolutely.
Yeah. So Ritu, we've been hearing a lot about these genetic testings recently. So do you think that these genetic testings can give us an answer if we have any autoimmune conditions underlying?
Absolutely, Ritika. I mean, you and I both practice as nutritionists here at Core Nutrition Clinics, and we've been doing genetic testing for the last couple of years.
Yeah.
So we do understand the importance of what a gene testing does to your body.
Mm-hmm.
Primarily, genes are something that you inherit from your parents,
Absolutely,
right?
yeah.
And these do get triggered at some point to express a disease in your body.
Mm-hmm.
It doesn't necessarily mean that if you have a gene, you will get a disease. But
Right.
the environmental stressors, just like how you mentioned,
Yeah.
sometimes can make the gene express, and then the disease is expressed in a person, and the person ends up having symptoms of that particular medical condition. So genetic testing helps you identify if you are prone to having any of the autoimmune conditions.
Right.
And that is going to be one of the primary steps to help you be in a more safer position to take control of your health,
Yeah.
and also to diagnose your medical condition more quickly. Sometimes what really happens is that by the time we diagnose a medical conditions, there is a lot of to and fro blood tests that we're doing. We're going to the
Right.
doctors, having multiple visits. Sometimes these autoimmune conditions are not diagnosed from
Yeah.
a basic blood work, right?
Right.
And sometimes the doctors themselves are confused, and
Not
they're
sure.
put at a
Yeah.
point where they're like, what's happening really,
Yeah.
right? So when you do a gene test, you basically identify that if you have a gene in your body
Yeah.
that is causing the disease.
Yeah.
And then at some point when you rerun your bloods and you do the right kind of blood work for the autoimmune condition,
Yeah.
you're able to catch it more quickly. So
Right.
to answer your question, genetic testing does help you identify and diagnose an autoimmune condition at the most earliest.
So Ritu, does it mean that everyone can do this test?
Absolutely. Genetic tests can be done by any age group.
Yeah.
And basically, even these days, parents are very invested in their kids' health. So they are
That's
all getting
nice.
genetic
Yeah.
testing done for their, young ones, and to identify medical conditions even before they kick in, so that they can take better control of their health
Yeah.
and also better manage symptoms.
That's an awareness we all need, right? And it's indeed a one-time investment that
It's
we
a
get to
one-time
know
investment.
about what's going on in the body, and we can take
Absolutely.
the steps just prior before it gets
Any worse.
Any worse.
That's
right.
true. That's true. Because like I said, genetic testing is one thing that you do for once, and then
Yeah.
it never changes. So
Right,
your results
because
never
it's
change.
genetics.
Yes,
Yeah,
right?
of course.
So you can always get it done once, and
Yeah.
then you have the report with you for the rest of your life. So the
Absolutely.
blueprint of your DNA is almost the most powerful thing you can ever own,
Yeah.
and is the biggest asset, if you ask me, in terms of your health, if you can
Yeah.
ever own.
Also, now that we've covered autoimmune diseases, I want you to throw some light on PCOS conditions because it's been faced by many women in recent times. Earlier, it used to be 20 to 30 years old that usually.
Now we're seeing as young as 15-year-old girls
Absolutely,
as well having
that's
it.
right. Yeah,
Yes.
yeah. So, so what do you think are the blood tests that are, majorly concerning, or the major reasons, or the diagnostic perspective? What are the blood tests that we have to run to diagnose this condition a little earlier?
Right. So one of the prime reasons why PCOS is going undetected among younger girls these days is the fact that irregular periods has become very common.
Right.
And
absolutely.
we see it like, okay, if it's happening to every other person, most of the time it's ignored.
Correct.
Right. And PCOS is a cluster of symptoms, right? And by the time the person is able to identify, okay, I have a couple of symptoms going on in my body, and then they go into the gynec's clinic to kind of diagnose or get this diagnosed, it's already too late. It's probably affecting more than one organ in the body, right? And we all know that PCOS is a cluster of symptoms, like I just told you. There is facial hair growth, there is a lot of hair fall that happens, and male pattern balding that happens. There's a lot of weight gain around the midrib region, which is around the abdomen region. We see a lot of weight that starts to stagnate there. And then we also see these clients have irregular periods, which is the most common symptom of a PCOS person, right? But we also need to understand that not just having all of the symptoms makes you PCOS positive. You can also have just one of these symptoms and still be classified as a PCOD or a PCOS, positive person, right? So the main concern here is the fact that diagnosis takes time.
Right.
And by the time we have reached the doctor's office, it's already too late.
Yeah.
And for a lot of times, doctors put you on an oral contraceptive pill, which then again increases the risk for a lot of conditions in your body, right? The major concern is the fact that younger girls these days are not focusing on what they're putting on their plate. Or rather, their lifestyle is so sedentary that food, what they're eating, is not nourishing. At the same time, with such less physical activity. Their bodies they end up producing more of these insulin hormones or testosterone hormones, which then brings us to the blood work front, which you were talking about. So these kind of hormonal changes in your body can put you at a risk for getting PCOS, right? And some of the blood works that I would like to throw some light on, especially for younger girls, and especially if parents are watching these videos, to keep an eye on, is to run some blood works for these kids, right?
Okay.
And some of the tests that can actually help you identify PCOS even before you go into the doctor's office could be checking their fasting insulin, which is one of the most common blood works that can actually throw light on PCOS. So again, this has to be taken with caution because we try and combine a lot of blood works together to identify if you have PCOS or not, along with some scannings which your gynec can be doing for you. But a fasting insulin, a free testosterone test, which falls under the hormonal panel. We've also got follicle stimulating hormone, which in short is called FSH, right? And then we have the estrogen hormone, which is also done as estradiol, which is again the broken down form of an estrogen hormone in your body. A TSH parameter, which comes under your thyroid panel, will also help you, and an AMH test as well, right? These are some of the common blood works that you can be doing for your kids, especially if you're starting to see symptoms of missing their period, or they're starting to see weight gain around the midrib region, or hair fall, which is very uncontrolled, right? So with this kind of a blood work, you can still walk into the doctor's clinic and then get further diagnosis done. And this, again, if you take charge of your lifestyle in a very younger age, you can
make
actually
huge difference.
make a huge difference in managing the symptoms.
And we can also skip the medications
You can skip the medication, absolutely. I mean, who wants to be on an oral contraceptive pill for the rest of your life, right? These things are least spoken topics, especially among women. And again, PCOS has been more common these days. It's affecting almost 5 to 6 women in among 10 of them. A lot of them are actually ending up with PCOS situations. So I think it's important that as a parent or as a caregiver or as a person yourself, if you're seeing these symptoms, it's important to step down and go in for an early diagnosis rather than waiting at some point, when it gets too severe, and then go into the doctor's clinic.
What do you think can happen if this PCOS goes undiagnosed?
So, of course, when you have PCOS and it goes undiagnosed, you reach a point where it starts to affect your fertility.
Right.
Yeah. Your fertility is the first thing. And as women, when your fertility gets affected, I think it plays a huge role on the
great news,
mental health.
Yeah.
For a lot of women, of course, it's not necessary that everybody
Yes.
would be keeping fertility in their mind. But overall, if your reproductive system is not functioning well,
Yeah.
you've got the impact on your overall health.
Right.
It starts to affect your mood, it starts to affect your energy levels, it
Right.
starts to affect the way you look, your physical
Yes.
appearance, and hair fall, which is among the most common symptom
Yeah.
of PCOS. And I don't think any woman wants to have
Yeah,
lesser hair for
right,
sure, right? I
right,
mean, you
yeah.
agree with me on that front. So, and the bigger problem and the bigger picture is fertility issues.
Yeah.
And when you start to have these fertility issues,
Yeah.
it then starts to affect your mental health very deeply.
Absolutely,
Right?
yeah.
And then you're going into these series of medications,
Yeah.
series of IVF cycles,
yeah.
and that puts you at a higher risk for every other medical condition,
Yes.
right? So, important is that you take charge of your
Yeah,
health,
that's
do
it.
your right blood work,
Yeah.
and then identify the disease, put a hold,
Yes.
do something about it from diet. And because
Yeah.
these are lifestyle conditions,
Yeah.
just like diabetes and cholesterol, you
Anything
can very
can-
well manage
yeah.
them, and your fertility issues will never creep in
Yes.
at any point.
Yeah.
Right? I think it's important that at this age and era, women take strong action on their health
Right.
and go in for early diagnosis.
Is the
It's no
key.
more a taboo to do a
Yeah.
blood work. It's just not somebody who is ill should be doing a blood work.
Yeah.
Everybody at all
Yeah.
age groups should get it done
Right.
to identify things a lot more
Yeah.
earlier.
Getting a regular check done now and then helps us to diagnose undiagnosed
Absolutely.
conditions, right? We won't even
Absolutely.
know like we have this condition, but
Yeah, it's
Yeah.
all hidden.
it's all hidden.
And
It's
by the
all
time
hidden.
you find out, it's way too late.
yeah, so we
Right?
have to start on medication in that case. And
Absolutely. So
nobody
it's
wants to be
important.
on medication.
That's right.
Yeah.
So it's important you start doing
Early.
your bloods early,
Yeah.
if at all
No.
you're seeing any of these symptoms.
Right. That was nicely put into and very informative as well. Ritu, what are the 3 main superfoods that you want to, tell the audience to start on when they find some symptoms like these?
Absolutely. I mean, there's a huge list, but we can always kind of break it down.
Yeah.
So my top one would be macaro tea.
Yeah.
To start incorporating 1 cup a day
Yeah.
to help with your hair fall and the stubborn weight gain.
Yeah.
The second would be seed cycling,
Right.
and this is a ritual that you practice.
That's
so
a
seed cycling
new
is
one.
it's kind of like a follicular phase and luteal phase where you got 2 phases to your cycles,
All right.
and you do take 2 sets of seeds, which is pumpkin and flax seeds,
Oh.
and the other set is sesame and sunflower seeds. So you need to take this as a routine for
Right.
3 months of time to see improvements. And the third would be my favorite, cinnamon.
Right.
Cinnamon, especially your Ceylon cinnamon, is really, really good.
Yeah.
It will help with insulin resistance and to improve your insulin hormone functioning in the body.
Right.
Yes.
So this can be followed like throughout their life, or is it like, a short period of time?
Absolutely. They can take this irrespective of
Yeah.
what age they are in,
Yeah.
or what currently what's happening with their health. But important is that you also, when you do your seed cycling,
Yeah.
if you have an underlying condition of thyroid, you want to be a little careful with your flax
Right.
seeds
That's what I was-
consumption.
yeah.
So that's the only takeaway point. But
Yeah.
anybody of any age group can
Yeah.
be consuming these 3 superfoods.
Right. Okay. Yeah.
Now that we spoke about autoimmune conditions and PCOS, do you want to throw some light about type 2 diabetes and why it's among the rise, especially among women? Do you want to help me understand a little bit about why it's more common these days?
Yeah, that's an interesting question. So we all have a seated job these days, and especially women, they just want to be a perfectionist in everything. So they have
Absolutely.
family stress, work stress, and just stress all around. So this gets them into their insulin being spiked up all the time, and always when the insulin spikes up, your carb cravings goes up, and then you indulge on a carbohydrate rich diet, and that's when the diabetes creeps inside our lives.
So you're saying more carbs,
Yeah.
more stress levels?
Yes, yeah, that has a relation.
correlation.
Yeah, direct correlation, and
And the driver molecule is insulin here.
absolutely,
Yeah.
that's right. That's
Yeah.
right.
Okay. Right. And what do you think, as women especially, because we are always the perfectionists, like you
Yeah,
said, and
yeah.
we want to achieve a lot of things,
Yeah.
and we put ourselves in a place where we take in stress from the family, we take in stress from the kids,
Yeah.
we take in stress from workplace.
Yeah.
So everything being loaded on us,
Yes.
plus sitting for the longest
Yeah.
hours in the day. And yes, of course, I wouldn't deny that women do a lot of household chores, which
Yeah.
actually is a kind of activity that can keep you moving through the day, but that's certainly sometimes not enough
Yeah.
driver
Yeah.
to help you control your sugars,
Yeah.
right? And between all of this, they're sneaking in a biscuit here
Yeah.
and there, they're sneaking in
Because
a
you
chocolate.
don't really have time to cut some fruits or snack in some nuts. You just go for already processed packaged one that's easier for you to do. So
Absolutely.
you just want to control your hunger.
Yeah,
That's it.
yeah, and nobody's paying attention
Yeah.
to what they're eating,
Yeah.
especially when they're stressed. The 5 p.m. hunger that strikes in, and
Yeah,
women
the
want
snacks
to
that
snack
they
on
want.
something.
Yeah. Especially when they
absolutely.
come back home
Right,
and they don't have time to make anything for themselves, so they just snack on
They just snack
biscuits,
on
chocolates, and whatever comes in package, basically,
Absolutely.
because it's easier.
It's
to
easier. I mean,
control your hunger.
convenience is over everything
Yeah.
else these days, right? So with all of this in place, what do you think as a pro tip, if you want to give, women should start doing in terms of blood work to get hang of, if there is a diabetes situation going
Yeah.
around in their body at
Yeah.
this point?
Especially also when you have a family history of diabetes, you want to make sure that you are repeating these stress now and then. So the main parameters when we speak about diabetes are the HbA1c, which is the 3 months average of your glucose, and then we've got fasting insulin, fasting glucose, and then we've got postprandial glucose and postprandial insulin. And I also want to let you know about this most uncommon parameter that nobody is aware about. It's the HOMA IR index.
Okay.
So this also should be checked, because this is a hidden blood parameter for diabetes that actually gives you an answer.
Okay.
Yeah.
So a lot of times we don't end up doing
No, we
HOMA-IR
don't.
index.
It's not very common,
Yes.
like HbA1c.
Exactly,
Yeah.
right? So I think another mistake that all of us do is that we only check our fasting glucose,
Yeah,
and
yeah.
for most part, you will see that your fasting glucose is all normal, because
Yeah.
it really depends, right? It's a subconscious thinking
Exactly,
that, I want to do my
exactly.
fasting test, so
Yeah.
I'll probably eat all nice and healthy today.
Right.
And then next morning, your fasting glucose absolutely will look normal
Correct,
because you're
correct.
eaten all good the previous day. But I think, like you said, the 3-month average really throws a
Yeah.
lot of light
Yeah,
on your
yeah.
sugar
It's
levels.
a very important parameter
It's
for
a
me,
very
at
critical
least, yeah.
parameter, absolutely right. So with all of this in place, do you think pre-diabetes and diabetes are things that can be controlled, things that can be reversed? And before we get into that question, what do you think about pre-diabetes and diabetes? What's the main difference between the two? And
Right.
should you be worried if you get into a pre-diabetic situation, or should you be taking a medicine if you are in a pre-diabetic situation?
Pre-diabetes itself is the starting stage of this diabetes world. So this is a stage where you can control with food and good lifestyle and some movements as well. And when you enter the diabetes stage, that's when you have to start taking medications, or if the HbA1c is higher than the normal ranges given in a diabetes, maybe you have to take insulin as well. So so when you are diagnosed with pre-diabetes, please be really proactive in incorporating good lifestyle and also making changes in your diet. When you enter the diabetes stage, you need some strong intervention by a professional for you to help to overcome or to help you with redesigning your food pattern.
absolutely.
So I would say pre-diabetes and diabetes both can be reversed with a good lifestyle and a good colorful plate.
I think that's very promising for our audience watching this
Yeah.
video, because what we largely see is that once you get into the diabetic zone,
Yeah.
a lot of them shy away from medicines,
Yeah.
right? Yes, of course, as healthcare professionals, as nutritionists, that
Yeah.
we don't strongly believe in getting into a pill unless your doctor really wants you to
Yeah.
start. There are cases where the doctors have actually given the person some time and said, go back, reverse your diet, reverse
Yeah.
your lifestyle, come back to me after 3 months, and then we look into
Right.
medicine, right?
They lower the dosage.
They lower the
because-
dosing as
yeah.
well, absolutely. So I think it's important that as nutritionists, we also tell our clients
Yeah.
it's important to manage your diabetes,
Yeah.
which means it's a triad, right?
Right,
You
right.
use exercise, you use diet, you use sleep and
Yeah.
stress management.
Right.
These three are kind of the pillars
Right.
to your diabetes management. And yes, of course, 50% of the time or 60% of the time, the person is already on a pill. And does that mean that when you get on a diet, you take off your pill?
No,
Absolutely not, right?
No, no.
I think that's an important parameter everybody
Yes.
should know, that the whole way to deal with diabetes is the fact that you start with your
Yeah.
diet, you start with exercise,
Yeah.
and there is no one size fits all.
No.
So you might need 3 months to go off the pill, or you might 6 months to go off the pill.
Or even a year.
You might sometimes even need
Yeah.
a year. So it's all about working with your doctor
Yeah.
on this. It's
As
not
well as
about
with the nutritionist.
Exactly.
Yeah.
So you will need some time to go off the pill.
Yeah.
In most cases, your doctors are happy to take the pill
Yeah.
off if you have very controlled sugars. And it's going to be a very gradual approach, right?
Yeah.
And weaning off of the medicine should happen under expert guidance,
Yeah.
both from the doctor's end as well as a continuous blood work. And probably like every 3 months, 6
Yeah,
months, we
3
want to be
months, yeah.
repeating our
Yeah.
sugars, right? to
Especially
see-
the HbA1c, because it changes
HbA1c.
every 3 months.
That's right. So repeating them over the time
Yeah.
and going back to the doctor and
Yeah.
coming back to the nutritionist,
Yeah.
sitting down and having that groundwork put into that will really help you wean off the pill at
Yeah.
some point. And I think that's the way to be approaching type 2 diabetes.
Yes.
And India is the growing country now. India is also the country where type 2 diabetics
Is
have
growing.
just growing.
Yeah.
Yeah. So it's again critical where diet is playing a huge role.
Yes.
Lifestyle changes are playing a
Yes.
huge role. And like you said, it's sedentary jobs are a
Main
huge
culprit.
hit there.
Yeah,
Yes. What is a pro tip if you want to give me about somebody who's into IT and sitting for the longest? They're sitting and working morning 10 to 6 or sometimes
Yes.
10 to 8 or even sometimes even early as 8 o'clock, 9 o'clock in the morning.
Yeah, so you should make conscious effort to move around every half an hour, or like you can have like an active colleague with you to remind you, like, let's just take like a 60 seconds walk, or like a 2 minutes walk. Let's just go grab something, or let's just shift things from here to there. Just like a very conscious physical activity, not really a physical activity, just some moments. That's
Yeah.
what all we need.
Yeah.
So or even like a timer, if that helps, because it's AI everywhere. Or
AI
even like
everywhere.
there's even an app that helps you to like remind you, hey, it's been like half an hour straight that you've been sitting around. So just take a 1 minute walk, or even to stand is a lot that you can actually do when you can't
Absolutely.
walk around.
Absolutely. I think
So-
that since having a standing desk to
Yes,
do your work.
exactly.
Yeah, actually
Yeah,
is like a
yeah.
savior tip. I mean, we as nutritionists also have very sitting jobs, unfortunately.
exactly,
And
yeah.
when we do our appointments, especially, we're sitting for long hours.
yeah.
And so is that something you also practice, to get
Yeah.
up and walk every
Yes.
1 hour?
Yeah.
To get like a 60-second break between your
Yes.
two appointments?
To appointments, yeah.
So-
So I'm like, of course, I'm not a perfectionist, but I try, because when I advise my clients, this is something that I also have to incorporate in my life.
Yes.
So that's when I know the struggle, how really hard is to walk between
Yeah.
when you
Yeah.
work,
Yeah.
and especially when you're doing a diet chart with full focus, which takes hours and hours, and you don't want to really leave the desk because you want to finish that job
You
first
wanna
and then
finish,
leave.
yeah.
And when that takes like straight 3 hours, and then you've already lost like 3 walks in between. So I
Absolutely.
think we need to prioritize our health, and we need to see our future, like if we keep on sitting like this without any movements, what we are going to get in future, like diabetes.
Absolutely.
In fact,
Absolutely.
yeah.
I think the takeaway point is that you make conscious efforts
Yes.
into this,
Yeah.
and before it's too late, start to do something about your
To
health.
move at least, yeah.
To move at least,
Yeah.
yeah. I think that's
Yeah.
that's the takeaway point for our
Yes.
audience watching
Yeah.
this video. Yes. On this Women's Day, start taking control of your life and ensure that you nourish your body with the right food and nutrients so that we literally age gracefully.
So basically, when we speak more about women's problem, that's when we get more closer to the solutions itself.
If this video resonated with you on this Women's Day,
Do like, share, and subscribe to our YouTube channel.